Abby. Okay. Hi, everybody. Welcome to Leo Live. And today I'm really pleased to introduce Abigail Parrilla and David Botting. And just both of them are colleagues of mine and have done some recent things around funding and taken some risks financially to the extent they felt comfortable to do, and even uncomfortable a little bit to do, to recruit a strong workforce. So Abby's CEO of the ARC of the South Shore. She has a long history with managed care as well before coming to the ARC, and which is really important because obviously we want to understand what the world is around us, the environment that we live in and work in. And David Botting is CEO of Community Connections, Inc., and he's been in the field a long time, but he came from another field and was in the accounting area, finance, got to know our space. And when it was time to look at succession, and David and I have talked about this, it just became a natural, move for him. And you've been doing that for at least 3 or 4 years, 5 years.
It's over 7 at this point.
Okay, I'm embarrassed. And then I'm going to get even more embarrassed with Abby because she was the chief operating officer at the ARC of the South Shore for a number of years. So I'm going to guess between those two roles, I'm going to guess, all right, fingers crossed, 6 years.
Yeah.
Okay.
At the ARC. Yeah.
All right. So, okay, that one I got right. So, so David's actually the last organization of the chapters today that joined as an affiliate, as a new affiliate. It doesn't happen often because of the investments people make. And just so you know, when chapters are an affiliate of us, they don't get an extra cut of any new funding that we win on or advocate on. So it's really, it's on the one hand, it's clearly an altruistic move, right? And saying, hey, we're going to support this advocacy for the world. But it also then, helps them really understand what's going on regionally, and they can translate what's going on to the people they serve. They can also help us with in-kind resources, not just the funding that keeps the national and state organizations going. And then we then try to, so it's like a core foundation for both the state and national organization of our funding. And then just so everybody knows, so you don't get lazy, but it does take donations to keep advocacy going at the pace we do it. So the donations, grants, all of that stuff. So it is a huge factor for what we do. So anyway, so is there anything special before we get going and talk about, before I interview on the things you've been doing, that you want to add about your background? Abby first and then David.
Sure. Well, again, I really just thank everyone for this platform. Thank you, Leo. Thank you, Leo, for your countless years of advocacy and support. We certainly can't do this without you. So thank you for the opportunity and the platform. I do want to share that, although I've been at the ARC 6 years, I consider myself a lifelong advocate. In 2008, I fell in love with the nonprofit space in long-term services and supports. So I've been a COO and a chief program officer for the Massachusetts Aging Services Access Point System. I did that for 11 years, where I found my voice in advocacy, lobbied for rate reform, for the PCM program, for the adult foster care, for the waiver programs. Money follows the people. I mean, really, we're in this together across the continuum of care. And I'm glad to have that background so that I can better serve. So excited about the conversation today.
And it's a great background for our space, so you could almost say almost 2 decades, of being in this advocacy space. And Dave?
Yeah, I'll just echo what Abby said. Thank you for including us today and giving us a chance to kind of share some things we've learned and to share some of our challenges and ways we're going about addressing those challenges. The only other thing I would add, Leo mentioned that I am somewhat new to this field. I did get involved about 7 years ago, but I did want to point out that going back many years, when I originally graduated high school and went off to college, I originally studied rehabilitation services. And for a number of different reasons, ended up getting diverted and going down a different path. But for me, being able to come back to the field I originally wanted to work in coming out of high school and college, it feels like a real blessing, and I'm absolutely thrilled to be here. It is without a doubt the best organization I've worked in all my years during my career. So I'm glad to be here today. Thank you, Leo.
Great. Well, welcome to both of you. So this is going to be interesting, and I think what I want to do is have you describe, each of your agencies first. And I'm going to let Dave go first this time because Abby, you have more of a I know your place a little bit, your organization a little, although it's different than from my time there in the 80s. Do you want to describe, Dave, just like the services you provide, just so
Sure.
people have a flavor of that, besides the advocacy you help us with in national office, besides some of the interesting stuff you've been doing with friendships, the co-hosting the Southeast Inclusion thing. Here I am taking your space, but
No, that's
what are
good.
the core things you do?
So Community
at
Connections has
CCI.
been around for about 38 years. And we provide services and support for adults with disabilities, intellectual and developmental disabilities. We operate from the South Coast, Fall River, Fairhaven, up to Wareham, even up to Plymouth. And then we have a number of programs here on the Cape, located at Mashpee and Yarmouth. As far as the different services we provide, day programming is clearly the largest service program that we have. We do community-based day supports, individual supports. We have a large employment program, and transportation kind of rounds out our core services.
So that's the base. So let me jump in here because I want to get to the meat of the. So we're talking about keeping your workforce today, folks, but I want people to understand agencies are all different, which is why so you have mass health funding for DayHab. What percentage of your day and employment, if you were to look at employment day and DayHab, what percentage is that mass health?
Yeah, mass health is probably about 70% of our overall. And then transportation takes up the big chunk next after that. It's almost like 20% maybe.
Okay.
So those are the big funders, those two pieces.
And when you get transportation money, does it come from Mass Health and DDS? You know what I mean? I'm just trying to understand like your transportation dollars for the DayHab. Yeah.
Yeah, it's transportation. Good point. Is to support the day program, to get people to and from day programs. That actually comes through GATRA. For us, is the funding source for transportation. So those are the two big pieces. And
which is a regional transportation agency. So people know that in turn contracts with HHS's transportation, whatever we want to call it, it doesn't matter. We can give you those jargons too later. So you're heavily in the day space. You do other stuff, but in terms of when you look at your workforce, right, you don't have like this whole cluster of other things. You may have other things you do, like I've said, for sure, in your community, you want to be visible, but you're heavily weighted there. Okay, hold on a second. I'm going to go to Abby for you to describe, because a little more multi-service oriented, and then you may not be able to slice it up the way David just did in terms of funding, but you might be able to give us ideas, in terms of between residential.
Sure.
Go ahead.
So we are, the Arc of the South Shore. It's been around since the 1950s, as you know. Part of a social justice movement that happened in this country where parents were no longer satisfied with the lack of services for their loved ones, for their children. They had two choices, as we all know. They could stay at home with limited support or have their children put into institutions. And that certainly did not fly with our valiant families that created the system. So at the Arc of the South Shore, we have a variety of programming, and thanks to those parents. And that's the lens through which I do my work. We serve over 4,000 people annually, and we serve the lifespan. So we have an early intervention program for children from birth through the age of 3. We have 10 group homes. Recently, actually, this Thursday, I'll be launching my first smart home, which is exciting.
Wow.
We do have a day habilitation program. We have a community-based day services program, like Dave. We also have a self-funded autism resource center that primarily focuses on caregiver support, information referral, and really innovative programming. We survive by grants because it's self-funded, but it's really important. There's such a need in that space. 50% of the population we serve actually have autism. 18% of our population are children under the age of 4, just to give you a little benchmark. But as I mentioned, we also have an adult foster care program, a personal care attendant program. We also have, within our residential space, we have a shared living program. So really multifaceted to try to meet the needs of the community, but it's still not enough. And you know and we have 224 employees, $14 million operating budget, just to give you.
So
a
so
bit
does
of
the
an
so on the, we'll start with, and great point about self-funding the Autism Center. I think the Becker grant trustees gave some money toward that because it was so hard to keep something like that going. But you have 10 homes, you've got your CBDS, right? You've got your day hab. Among each other, like obviously homes is a different animal. But where were you having the most trouble in retaining workers, if you were to say over those three areas? Let's keep EI out of it for a minute, even though that can be tough too.
I would say certainly day hab and residential, and day hab is CBDS Tamir, pretty much the same but I would say the real struggle, residential and our rehabilitation program for sure.
Okay, and your numbers before COVID in terms of vacancy and how much worse, and I'm going to ask David the same thing after I ask you. And feel free to jump in and add something. I know I'm cutting David off and you off a little bit, but I want to get to the what you've been doing as well. But what do you think, how much worse did it get? It was tough before COVID, correct? Recruiting for staff?
It was, because we know that the pay has always been lower than the work. It's merited at a much higher rate.
Right.
So it was difficult, and it was always me being creative with, selling culture and great benefits. I mean, we were at $14 an hour prior to COVID.
Wow.
But we were strong in terms of our retention. We were at about a 17% retention rate. So, but it was constant focus in that area. Then COVID hit, and wow, what a challenge. It was just, the whole landscape changed. I know I'm preaching to a choir here of people who've experienced it as well, but the whole workforce paradigm shifted. Where did they go, right? The mass exodus in the workplace, and then retaining these healthcare heroes. I don't want to put the cart before the horse in terms of the discussion, but you started to see it as we started to have to close certain programs. And for us, the only program that was actually stayed open was our residential program. So that was a real struggle. I want to stay there at the pandemic. Before the PPP loan came about, before ARPA, we're stuck there in a pandemic, having to serve 10 group homes and keep people safe, create quarantine pay with a budget that was stretched beyond measure. Really challenging.
Wow. All right. And then Dave, you want to comment? And then go ahead.
Similar to Abby, and they program for us took the biggest hit, and consequently transportation, of course. Vacancy, so it's interesting, where we're both on Cape and off Cape, we saw a very different environment between those two locations. And off Cape was doing fine. You're always going to have vacancies, people come and go, but we were able to staff and keep a full complement in place. Cape was struggling because over the last few years, housing challenges and the cost of housing on the Cape, if anyone's familiar with the Cape market, we began to see the squeeze for the workers on the Cape. And so we started to see much higher vacancy numbers at our Cape programs than we did off Cape. And like Abby, thankfully, a lot of the funding that started to come out, the PPP, Employer Retention Tax Credit, ARPA, we took full advantage of each and every single one from the get-go. And because we did, we never had a layoff, other than for 2 weeks, we had to let our drivers go on layoff, and we brought them right back after 2 weeks because we were successful getting that early funding. So even though our programs weren't open, we continued to pay our staff during those early months of COVID.
As did I.
Yeah, so you guys had at least a base that would come back.
Yep.
Whereas people had, what do you call it when you lay, is a word for it? You don't fully lay them off. You're
well, reduction in
furlough.
force.
Also people
furlough,
right? Okay.
Furlough, yeah.
So now what happened though is getting full staffing back, even better than pre-COVID, was pretty tough, right? You're in competition.
So,
Correct.
yeah, so what happened for us is, first of all, many of our staff were older. And there was real fear in that population to come back, not knowing. Remember, there's so much uncertainty around the COVID. And so even though we continue to employ some of those folks, they began to gradually say, you know what, I'm going to use this time to retire and I'm going to step away.
Wow.
And those folks started stepping back. And that's where the real trouble began, because, you know, as those seats became empty and we tried to fill them, we really struggled.
So Abby, I think I'm letting him say what he did first, and then you share what you did, because it's,
Certainly.
you made a bigger bet. Yeah, you want to start, Dave, and what you decided to do to try to, you know, in addition to morale and all that, the financial piece of it.
So we lost that group of people, the ones that were older. Then
Yeah.
we began to see that we were losing people to other jobs. The fast food restaurants, the retail stores,
Wow.
they were started, and everyone knows this, right? You began to see signs in the Home Depot or Target, or $15, $16, $17. Like Abby said earlier, we were stuck at $14. And so now suddenly we had people starting to leave. Like, I can make more money working over at Chick-fil-A than I can here. And so that accentuated the fallout and the people leaving. And so that's where we stood. So we were down 60%, give or take, with our staffing. Our pay, because of the reimbursement rates we were getting from Mass Health and from the state, didn't allow us to pay more. But what happened, as I said, once we started applying and getting some of this federal funding related to COVID, well, suddenly we had some money available, and we began putting through increases, rather significant increases across the board to our different positions. But, and I know Abby's, you're going to get into this a little bit yourself. I won't steal all your thunder.
It's okay.
But the challenge for us, for people like Abby and myself, is, you know, how much higher do you take these wages and salaries, knowing that those reimbursement rates aren't necessarily going to be as high to allow us to afford it. Yes, we can afford it now with the funding, these temporary short-term funds we got. It's temporary. It's
So
not
let me
long-term.
add to that, and I'm going to switch to Abby. So what happened, for people to understand, there's two types, right, of short-term funding. One is funding you just got through PPE and other ways. When you say PPE, it was a federal program. There's other federal programs that Abby's, I think, applied for too recently. And then there's rate increases that are temporary. Okay, just for people to understand. So, and people, what you have to appreciate, when he mentions $14 an hour, Mass Health historically was not addressing day habs. In fact, there was groups that were attacking family groups, saying, oh, I would never think of day hab, or my day hab, you know, all this kind of talk, because there had been very little movement on rate increases in day habilitation for several years. Okay, just for people to understand that. So when he's got X% of his program there, you know, David, and he's so, and then he's also, when he says 14, you know, if you have someone who's worked 7 years, you want to give them higher, right? You want to see them get raises. So the benchmarks, this average benchmark, some of the lowest paying people are getting 14, you know, because that's, you want to reward the people that have been there. You don't want them to leave, because everyone's going to get the same salary. So those are, I'm just adding a little spice there so people understand the depth of what you're juggling. Because when you get a payment rate, I think in the DDS side, before COVID hit, it was $15.52 an hour for the DSP benchmark. That's a benchmark. You're not required to pay it, but that's for if someone's worked 1 year for you, or 4 years for you, or 8 years for you. Think about that for a second. Okay, so you're going to have people less, you're going to have people more. Abby, go ahead and talk about what you guys decided to do, and what you were facing, and then the situation you were facing, as David did.
Sure, take over right where Dave kind of left off. So here we are, pandemic response, trying to get, we all did it, you know, get a workforce through holistically, because it was a mind and body and soul experience for all of us. We've got individuals to care for, employees breaking down, personal lives collapsing, people getting sick. We actually lost a direct service professional to COVID. This just the bubble ramification effects of the pandemic that we all know. So I'll put that aside. We're dealing with all of these psychosocial issues as a community, as an organization, and then there's the finances. Then there's the retail spaces jumping out ahead of what's going on and really grabbing a big piece of our workforce. Now, we went from the 14 to the 17 because we paid attention to what was happening and we didn't have a choice. And we were lucky to get the PPP loan. So I want you to put on the side here as I have this conversation, one-time funding, because that's all I'm thinking as this is happening. This is one-time funding, so it's going to get me through this year. All right, PPP loan gets me through this year. We're going to go up to $17 an hour because we need to retain a workforce. 17 for your entry level, but you have longevity in these organizations. Luckily, I do 25 years plus direct service professionals. So then you have to look at compression and raising everyone else. So it's not merely going to 17. From an equity standpoint, you have to look at everything. So quite costly. You get through that year, and then you realize it's not enough. One of the things that happen, if you want to look at, and I've always said, I want to preface this by saying, even in my years in elder care and long-term services and supports, we all know that the true cost of operating a nonprofit, at least of my size and scope, $14 million operating budget with all of the needs, it has always fallen short of the true operating costs, the funding, right? The reimbursement rate. So that's always been the advocacy push, what we've lobbied for, and now it hit greater heights like never before because we don't have an opportunity to get this done through advocacy and working with our legislators and our regulators. We've got people right now that are jumping ship for $17 an hour, maybe in a fellow nonprofit, but basically mostly in the retail space. So you're going through all of these shifts in understanding a workforce and having to move very, very quickly. I remember making the move to $17 an hour and then 3 months later going to $20 an hour. So that's where I want to take us because I can go on and on about how we got there, but having to really have a real discussion with the board. And board transparency is critical in all of this because we had to create various scenarios jumping out ahead of the workforce crisis, but also educating a board on what was happening with, I never like to call them competitors because I think we're all doing such great work. I like to say similar nonprofits doing similar work, right? They are going up to the 20, and I've got a deficit budget for the first time in the history of the organization in the last 20 years. Wow, crazy times, difficult times, but you have to be strategic. So we present something to a board, give them 3 scenarios. If we don't go to 20, it's going to look like this. If we do, it's going to look like that. Luckily, I have a board that understood the need, understood that if not during a pandemic, when do you approve $1 million deficit to go to $20 an hour? Yeah, that's what it looked like. And it's not just me, for a lot of us. Of course, then your mind is going to, how do I plug that hole? It must be plugged. And we get all this wonderful one-time funding. You get the ARPA and the earned income tax credit. Some of us are still waiting for a lot of this, by the way. So we jumped out ahead of it, took the deficit, invested in our workforce. Guess what I got? And I speak only about the Arc of the South Shore because everybody's situation is different. Many nonprofits do not have a surplus to pull from which to incur a deficit. I have to be really honest about that. And so lucky. However, you still have to plan fiscally for the next liquidity for the next 3 years, which is the real danger. Another one that I want to put in the parking lot. So you get through it, you retain a workforce, and here we are at the $20 an hour, plugging deficits left and right. For me right now, we are all so incredibly grateful that we have these, these funds to pull from. But now where I sit for the purpose of this discussion is when the one-time funds are exhausted, which will be very soon, ladies and gentlemen, I'm looking at 2024, 2025, certain things have to be put in place now strategically. So I'm just looking at strategic partnerships with, Leo, again, amazing advocacy efforts, the ADDP, our regulators. Let's talk some rate reform. Let's really get out in front of this by not plugging another hole, but creating a rate structure that's sustainable. I just want to leave it there because I don't want to infiltrate the conversation.
Well, I want to ask you just one thing, and because of what have been the results going to 20?
I got back to lower than pre-pandemic retention rate. I can't even believe it. I'm going to tell my board on Thursday. I've got 16.9%, which is amazing. And
Is that 16.9% vacancy or
retention rate?
Retention rate.
Lower
Wow.
than the national average, which is
Right.
amazing.
Wow.
We're at 22% during COVID, and the year after, 21%. So the lower it is, the better it is. I think the national average is in the 19% of retention. So that's how we got there. I mean, money took on a new form in the workforce, but also not just money. I invested a lot in culture and understanding because everyone else was also offering it. And then plugging that deficit slowly and steadily. We are getting closer to a $200,000 deficit. I don't want any deficit, but I still do not have my programs at full capacity. I'm still running about 60%, 55, 60% in my rehabilitation program. Still at about 65 in my CBDS program. So we are slowly getting there, but we are still feeling the pinch. And I mean, it's an all hands, all type of lens approach. It's strategic planning, it's board alignment, it's advocacy, it's working with your regulators, and we have to do it now because we still have these little buffers in place, but
Right.
we won't in 2 years. So what's going to give then?
And just so for 20 rehabilitation centers where they were freestanding or integrated have closed, officially as well. And that's important for people to know across the state. And one of our colleagues, her daughter went there, and now there's not one close by that is right for her daughter. That's the right age people. David, you guys made a similar kind of move, not to 20, but to get to 18, I think you were saying, because you just felt like you had to do something and you had to look at, the feasibility financially, and that's what you were able to do. And what was the impact of that, and what did it take, to do that?
So Abby used the word earlier about sustainability, and that is the key here, right? Today, both Abby's organization, my organization, we're lucky. We've got this extra funding that came to us as a result of COVID. And the funds are available to increase the wages. However, it's temporary, it's short term. And so it's not sustainable unless reimbursement rates increase 2-3 years down the road. The piper's going to have to be paid. And if those reimbursement rates haven't increased, the money that we're paying today will not be sustainable. And so we have done what Abby and her team have done, and that is increase wages. I'd say over the last couple of years, double-digit increases for our direct care staff, upward to close to 20, 25, in some cases 30%. And so we're proud of that and we're happy, but we know it's not sustainable. So we talk a lot here at Community Connections about the bridge. We've got this bridge today that will get us to the other side. But the focus now becomes, what are we going to do once we get to the other side? So it's that strategic planning that Abby talked about. It's coming up with a plan, rethinking how we deliver our services, what that financial model looks like. And we know we've got 2 to 3 years to figure this out. And that's where we're giving the majority of our focus these days.
And you had the same problem Abby had. I'm assuming, Abby, I think you spoke in a way people could understand in very quick fashion. I was impressed how you talked about the pressure on other salaries when you do things. Compression, it's called, folks.
Right.
The word she used. And you had to deal with that as well, Dave. You didn't say the hell with it. The program manager's now making 50 cents an hour more than you had to think that through as well, correct?
That's exactly right. Compression is when you're increasing the lower end of your salary range. If you don't do something for the people above, you've got a veteran, someone that's been with you 20 some odd years, and they're saying, wait a minute, this person coming in is only making a couple bucks less than I am an hour. That can't be fair. What about all my years of experience? And so you can't just change the lower end and do nothing for the top end. So yes, we've had to deal with compression, and that increase goes across the entire spectrum.
And before we go to the questions, there's some questions on here that I really want to get started with. I was going to say, anyone off the top of your heads, talk about the variance in the benchmark rate for nurse salaries off the, how much that's a problem too, because there's clinician issues too in our field, right? Having those people to help your direct support staff and managers properly, develop planning and whatever, right? Anyone, I'm assuming you still have that problem, right? With that level staff, because it's same thing, same difference, correct? Either one of you. Well, we'll just go with that. All right. What I'm hoping to play this for, by the way, is also a couple of folks in the legislature, so they can hear in depth sort of what we're sharing.
I just want to add one thing,
Yeah.
Leo and group, and we all noticed that one thing I didn't want to leave this discussion without saying that even if, and this is, believe it or not, the minority, some organizations are struggling, but even if you're lucky enough that you're financially healthy at the moment, there should be a plan B and C, especially if your organization is greatly dependent on limited resources, limited programming. I mean, there's some organizations that just have residential, that just have, and most of the programs are all running deficits now. Is please have your plan B and C and really strategically map that out in a number of buckets. So it is your board transparency, what that's going to look like 2 to 3 years down the line, your legislative support and advocacy plan to get it out around rate reform and changes to reimbursement rates, and your agency culture and expectation. Those 3 things have to be looked at, and they have to be looked at now, proactively, with a vision, right? And so I just wanted to get that out there, because we can get out in front of this, and we can put in cost containment efforts. This is a positive approach to how we get out in front of it, is what I mean.
And the question from Charlie to Abby, and I still part of your challenge in coming back to 100% is a lack of DSP staff. True?
He certainly was. Oh yeah.
People weren't applying. People
Oh my
in the
God.
field. Giassi had asked earlier, why were retail places able to pay what they paid more? Well, because they can charge a higher price for what they're selling. And I mentioned in the chat, I go to a supermarket, I see a bunch of higher prices. I go to a drugstore, I see a bunch of higher prices. It's really, yeah, David.
Yeah, one thing I want to add here too, and Abby, I don't remember if your organization did this or not, but I want to point out that a number of organizations that found themselves in the same boat as us, one of the things they decided to do was to offer hiring bonuses.
Oh, we did.
Did you? And we had a lot of conversation here at Community Connections around that. We opted not to, and here's why we did that. We felt our fear was, in doing that, it was attracting people to our organization for the wrong reason. Not only that, we also felt it was somewhat of a disservice to our dedicated staff that have been with us for years and years and years, to reward the people who had not worked here right off the bat with these bonuses. But we knew in doing that we were losing an opportunity, right, to bring people in quickly. And it was a decision we made. It was a difficult decision, but it's one that we think long-term will pay off. In other words, we're spending a lot of time talking about retaining our workforce and not so much attracting people through the offer of extra money. But that's not an easy decision. And those organizations who chose to go with a hiring bonus, I don't fault them at all. It was, but I want to put that out there to show or demonstrate kind of the challenges that we have in filling up these empty seats again. We don't want just people coming to work here. We want the right people. And we didn't want to sacrifice quality. We didn't want to sacrifice safety. And so it's a choice that we made. But One that every day I wonder, could I get more people in quicker if I had offered hiring bonuses? And we've not done that yet.
Yeah, we did, and I did find it successful, David. I was in the same position as you. Should we not? I always look at this through what are similar agencies doing that could possibly attract my workforce that are in my very near to my zip code.
Right down
And
the
they were
street.
doing it.
Right.
If they're doing it, I'm doing it. And I did it and I'm still doing it. I mean, I got to the point that we finally got all of our van driver positions filled. The reason van drivers are so important for us, particularly in our CBDS program, it's how we get our individuals to our program. So that was really important. $5,000 sign-on bonus. Yeah,
Wow.
we went there. And just finally last week, I have full capacity of van drivers. So now I can bring all of these individuals back into programs that are in such need of services because they need the transportation. So it was not an easy decision. It paid off for me, David, and the rest of the group, only because I just tried to see what was happening in my backyard and I had to follow suit.
Yeah, and
So-
then I got a question here from Sarah. Do you see availability of affordable and flexible childcare as a factor in workforce retention?
Yeah, absolutely. I can say yes to that. I'll add that I'm currently the board chair for the Cape Cod YMCA, and they have an extensive childcare program there. And I can see the challenges they're having in hiring staff to be able to provide that childcare. And so that's a piece of it. And as I said earlier, here on the Cape, definitely the higher cost of housing is driving away a lot of potential help here on the Cape.
Any other questions people have that want to add at this point? I have a bill. I'll go ahead, David. You want to make a point?
Yeah. Sorry, if I could just go back
Yeah.
to the comment about the hiring bonus. So when we decided not to do the hiring bonus, I said to the staff, I said, hey, guys, we just can't say, well, we're not going to do it and expect things to change. So we completely revamped our recruiting efforts and process. And we looked for ways to streamline it, to make it go quicker, to get the right people involved sooner. So I just want to make it clear, it's not like we said, well, we're not going to do this and didn't come up with an alternative.
No.
We were very strategic and made some significant changes in the entire process of how we recruited and onboarded our staff. So that's where we put our focus, as opposed to putting some financial numbers on those. And I'm sure, Abby, you did the same thing when it came recruiting. It wasn't just one thing that we could do, right? It's multiple initiatives.
Oh my God, yes. And there's no right or wrong. There's no playbook on this, by the way, given the circumstance, but also no two organizations' geographic footprint are quite the same, or body of employees. So I think given we both did the best we could with the population that we had in terms of the workforce, I chose to concentrate also on merit. So definitely you get merit bonuses here based on a performance evaluation. That was highlighted to your point, David. We looked at everything in terms of how we reward staff.
So I want to share something. First place, I'm going to show something not directly related, which is a bill platform that Maura Sullivan worked up over the weekend, because all the bills went into docket. 20th was the deadline for bills, and the top of the bills are workforce priorities. And I'm going to show you that bill in a second. That is specific to our space. And then there's a whole bunch of other things which I'm going to now stop share of. And then I'm going to share the workforce bill really quick, and then we'll get to another question in a minute. Let me just share the workforce bill. Here it is. So what we decided to do, and we actually had something in play before a few years ago when we were successful to get a 10% increase in the residential rate before COVID, and it had been the biggest increase, for 7-8 years. But it still wasn't enough. But we couldn't ask for 20% because they think we were crazy, and other organizations weren't advocating with us for a 10% increase, which would have meant $220 million that year for the appropriation versus $160 million. So this bill that ADDP has joined us on and helped revise, and then Senator Feingold is the Senate sponsor. The House sponsors are Sean Garbely and Simon Cataldo. Rep Garbely, Chair Garbely brought in Simon Cataldo, he's newly elected representative, to help co-anchor this. And then Denise Garlick, one of our champions in the state legislature, chair of third reading. I don't know what she'll be chair of this year, but that's what she was last session. She's also going to be strong on this in the House with Senator Feingold, Senator Lovely, and others will be, but Senator Feingold is the sponsor. But basically, it outlines all the services in DDS that are 257, chapter 257, but we added mass health rehabilitation and always intended to as part of it to get the right. And it talks about minimum of 75th percentile of the Massachusetts Bureau of Labor Statistics. And actually they took in the editing, they took that out, but hopefully that's what is understood. And it goes through this, and it would affect compression that Abby referenced earlier, and it'll affect clinicians. And it says you can't take money from Peter to pay Paul. So there's actually a couple of clauses in there. And there's 2 different rate processes. So we had to have different sections for the different rate processes. So I just wanted people to know that's there. There's also a community college pilot that's there. But if Senator Spilka and Governor Healy proceed with their 2 different, well, I guess Governor Healy's would only apply to people 25 and older. So our pilot would still be relevant. Senator Spilka has a proposal to make community college free for everybody. So our pilot would make it really free for people who work 2 full years for one of our agencies in our space. So I just want to share that's an important thing, even if it doesn't pass as a flag. But I do think people in the legislature need to know who the people are that we serve, right? And I think if each sector does that, people with mental health conditions, people, children in foster care, I think it's really important to identify for the legislature who's losing out when these reimbursements aren't appropriate. And we just got a couple other chats. So in addition to the cost of housing and availability of childcare, how does access to cost of elder care factor in recruitment and retention? I don't know if that's relevant. Is it, Dave?
Yeah, I would, and good to see my buddy Alan on the call here with that question. I wouldn't say the cost of elder care, but I would say the availability of elder care, because what we saw was a number of staff having to leave to take care of their parents.
Okay.
Because there wasn't availability. Either, the nursing homes were being shut down, or day programs that they were going to they couldn't go anymore. So yes, we've lost staff to that.
And I want to add to that as well. I saw directly correlated, I think, great question or great observation. I saw my adult foster care program actually grow during the pandemic. It was unbelievable the number of referrals and how many families we helped, particularly elders, because the adult foster care is a program that is not just for IDD, including autism, anyone with a diagnosis that would have them qualify. Particularly, we saw an uptick in elders that applied for the program and got enrolled during the pandemic, helping families stay together and avoid nursing home placement and keep the family intact. So there is a correlation.
And then there's 2 final things: workplace surveys. If organizations, how do they use those to balance support between recruitment and retention of staff? So, you have that, like, I get it. I get that sort of balance, right? How much do you invest in A versus B? David, and then Abby, if you want to answer.
Yeah, sorry to jump in, Abby. We do use surveys, and we've been doing it for years, and we rate rather highly with our staff. The good news is, despite all the challenges the last couple of years, our surveys have actually increased in terms of our scores. And it's something we feel good about, because it does speak to what we're trying to do on the retention side, which is the culture. I think Abby talked about that earlier, and creating a workplace where people want to be, feel valued, and yeah, the pay may not be as good as they can get somewhere else, but this is where they want to be. And those are the kind of people we want delivering the kind of service, the safe service, the quality service that the people we serve demand and frankly deserve.
Right.
I agree. We also have an annual employee satisfaction survey. We've done better and better in the last 6 years that I've been here. And what I always do is I really take them seriously. Something that also came out of the pandemic and out of our employee satisfaction surveys was our town halls, which I've kept in place. I really believe that you need to meet with your staff. We did it remotely. I kept those going. I'm doing them in person, different times, 1 in the morning, 1 in the afternoon, to make sure I can get people in here because people work different shifts in residential, and also a hybrid version. Listening to your staff is going to give you the best outcomes. I mean, you just have to listen. And that's what we do. That's my gauge for, I always say this, but your happiness as an employee is my gauge for success, and, bringing joy to the individuals we serve. So you have to listen. And surveys are not just for data, which I love, and for a board report, but you have to make a tangible difference with the data, and that's talking to your people.
Lori's asking about a higher bar in the hiring process. Have there been a higher bar? It includes value-based orientation and training. And she said in her experience, she would run into people that were DSPs who had never worked with people with disabilities before and not get good orientation around real community inclusion or social role valorization, the implicit bias, that many in our community face, those kinds of things, self-directed options. So maybe you could both touch on that, and
I can speak to that a little bit. I know that something that I'm looking at my entire HR platform from the lens of retention and recruitment, marketing materials, attracting. To David's point, I say the same thing too. I want the right people doing this kind of work. If you want to go work in a retail space, go for it. I don't sell ice cream. I sell a human social service, and I want people that do that with joy, right, and integrity. So what we do now, honestly, this just came up. We actually have people tour way before they even go through the process. This is new. You want to work in a group home, spend a day shadowing. It's an investment. You're not paid for it. Spend a couple of hours. I'm going out on a limb doing this in our programs, but I think it's going to speak to the integrity of the services we provide. So this is a little pilot that we're working on right now, but I think it's very important.
Great, thank you.
This is a great observation. Is it Lori? Yeah, Lori. I talked earlier about revamping our onboarding and recruiting process, and I'll give you a great example of this, which speaks to Lori's point about many people applying have never worked with this population. And so my HR team is, when people reach out and apply, let's have a conversation. And it's about, what do you think's involved? And let me tell you more about this. And we have actually had a number of people apply for positions, and we have steered them into a different position. After talking to them, learning what their strengths are, their skill set, and what their interests are, we said, you know what, we actually think this job over here is better suited for your skill set and your background. And we've had those people come up back to me and tell me, thank you so much for your HR team to take the time to learn and get to know me better, understand what I want, and direct me into this job, which I absolutely love. And I never knew anything about it until I applied there. And this is the perfect job for me. And so we have to be attuned to what Lori's talking about. People applying here, they may not know about us. Take the time, tell our story, help them understand what's involved, and you're going to get a more dedicated employee in the long run when you take that investment time, as Abby talked about earlier. Make the investment. It pays off.
Great. All right. Well, it's almost 10 to 1. We usually end at 12:45. So I just want to thank you, Abby and David, for being
my pleasure, my honor.
And thank you all for attending, and we'll be posting this, and we'll be encouraging some decision makers to see it. And it's great to see, the mix of people, families, and some of our other colleagues that sat in, a few of them, and Rich is still with us here from Beef here, so good to see him too. So I just want to wish everybody oh, I want to warn everybody again, we're going to keep reminding you that, the winding down of the public health emergency, that people will be getting letters from the state about their Medicaid eligibility. It's really important not to ignore those letters starting now. It'll be over 12 months, the redetermination. We also have something related to that coming up with Michael Andrade. Is it February 1st, Kerry, where he's going to talk about that right now, legally responsible entities could not do able for people who have too much money, right? One of the reasons you can get kicked off, besides you getting a letter that's incorrect, is because you have too much assets. We still have a cap of $2,000 and $3,000 for couples. And Michael's going to talk about that and the arrangement made with Stable, which is Ohio-based, because our ABLE doesn't allow someone who's the legal corporate trustee or corporate, it's beyond trustee, right? It's manager of those funds. And that's for people that are represented payees, right? And others that have roles, but he's going to explain it at noon, right? In a couple of weeks.
February 1st at noon.
And
Yeah,
then-
and the other thing he's going to cover is really, with an increase in Social Security and because of COVID, people have had a hard time with their asset limits. So how important it is for you really to zero in on that and make sure that's protected so you don't lose your benefits.
And some
So it
agencies.
should be great.
Right, and some agencies actually manage this or indirectly
Yeah.
manage it, so it's really important to
Yeah.
get it right. But again, this is something able or attainable in Massachusetts does not allow yet. They haven't, despite there be talking about all of that. So, all right, and thank you. And Lori said, hey, maybe you want family members joining you too, and with the orientations and stuff, always a good plug. And that's how we started, was parent professional partnership was a big theme of the ARC in the 60s and 70s when I was just born. No, I was born a little before that. But anyway, thanks everybody for coming and have a great week. And really, again, appreciate Abby and David for being our guests. Take
My
care,
pleasure.
everybody.
Thank you, everyone. Let me know how I could be of service.
Great job.